feeling drained all the time? You're not alone. Chronic fatigue is a challenging condition that can disrupt your life, making even the simplest tasks feel overwhelming. But there's hope. With the right strategies, you can find relief and regain control of your energy levels. In this guide, we'll explore practical approaches to managing chronic fatigue, from lifestyle adjustments to holistic care methods. Whether you're newly diagnosed or have been battling fatigue for years, this article offers compassionate, expert advice to help you on your journey to feeling better. What is chronic fatigue? Understanding the basics. Chronic fatigue is more than just feeling tired after a long day. It's a persistent, overwhelming sense of exhaustion that doesn't improve with rest and can significantly impact daily life. Unlike regular fatigue, chronic fatigue persists for 6 months or more and often gets worse with physical or mental activity. Key characteristics of chronic fatigue: persistent exhaustion, a constant, deep-seated tiredness that doesn't go away even after a full night's sleep or extended rest. Disrupted daily activities. Routine tasks can become challenging or impossible, affecting work, social interactions, and personal responsibilities. Physical and mental strain. The exhaustion can be accompanied by muscle pain, joint pain, headaches, and problems with memory and concentration. Fluctuating symptoms. Symptoms may vary in intensity, often becoming more severe with exertion or stress. Potential causes of chronic fatigue. Medical conditions like chronic fatigue syndrome, fibromyalgia, and autoimmune diseases. Infections. Past infections can sometimes trigger prolonged fatigue. Mental health. Stress, anxiety, and depression can exacerbate feelings of exhaustion. Lifestyle factors. Poor sleep habits, inadequate nutrition, and a lack of exercise can contribute to chronic fatigue. Understanding these basics is the first step towards managing and alleviating chronic fatigue. Identifying its presence and distinguishing it from ordinary tiredness can help in seeking appropriate help and treatment. Diagnosing chronic fatigue. What to expect. Getting a proper diagnosis for chronic fatigue can be a complex process because the condition doesn't have a single definitive test. Instead, it involves a thorough evaluation to rule out other potential causes and confirm the presence of chronic fatigue. Steps in the diagnostic process. 1. Initial consultation. Medical history. Your doctor will ask about your symptoms, their duration, and how they affect your daily life. Be prepared to discuss your medical history, lifestyle factors, and any recent stressors or changes. Symptom checklist. Common symptoms of chronic fatigue include persistent tiredness, sleep disturbances, and cognitive difficulties. Providing detailed information can help in the diagnostic process. 2. Physical examination. Health assessment. A physical exam may be conducted to check for any physical signs of illness or other conditions that might be contributing to your fatigue. Vital signs. Monitoring of blood pressure, heart rate, and other vital signs to assess overall health. 3. Diagnostic tests. Laboratory tests. Blood tests and other diagnostic tests may be ordered to rule out conditions like anemia, thyroid problems, or infections. Imaging studies. In some cases, imaging studies might be used to check for underlying conditions that could be causing fatigue. 4. ruling out other conditions. Differential diagnosis. Your doctor will consider other conditions with similar symptoms, such as sleep disorders, chronic infections, or metabolic disorders. It's important to rule these out to ensure a correct diagnosis of chronic fatigue. 5. Assessment of psychological factors. Mental health evaluation. Since stress, depression, and anxiety can contribute to or worsen chronic fatigue, a mental health assessment might be part of the diagnostic process. Preparing for your appointment. Track your symptoms. Keep a diary of your symptoms, including their frequency, duration, and impact on your daily life. List medications. Provide a list of any medications or supplements you're currently taking. Prepare questions. Have questions ready for your doctor about possible diagnoses, treatment options, and lifestyle changes. By understanding what to expect during the diagnostic process, you can better prepare for your appointment and work with your healthcare provider to determine the most effective path forward. Lifestyle changes to combat chronic fatigue. Making lifestyle changes can have a profound impact on managing chronic fatigue, and while these adjustments might not provide a cure, they can significantly improve your quality of life and help you manage symptoms more effectively. Nutrition for energy and recovery. Focus on a well-rounded diet rich in fruits, vegetables, lean proteins, and whole grains. These foods provide essential nutrients and energy. Drink plenty of water throughout the day to stay hydrated, as dehydration can worsen fatigue. Avoid excessive sugar and caffeine, as they can lead to energy crashes and disrupt sleep patterns. Incorporate regular exercise. Start with gentle exercises like walking or stretching, gradually increasing intensity as tolerated. Aim for regular, moderate activity rather than sporadic, intense workouts. Consistent exercise can boost energy levels and improve overall well-being. Pay attention to how your body responds to exercise and adjust your routine to avoid overexertion. Improve sleep quality. Go to bed and wake up at the same time every day to regulate your sleep patterns. Ensure your bedroom is dark, quiet, and cool. Consider using blackout curtains and white noise machines if necessary. Avoid caffeine and electronic screens before bedtime to improve the quality of your sleep. Manage stress effectively. Practice stress-reducing techniques like deep breathing exercises, meditation, or progressive muscle relaxation. Organize your daily tasks to avoid overwhelming yourself. Break tasks into manageable steps and prioritize self-care. Holistic approaches to managing chronic fatigue. Holistic approaches can complement conventional treatments and provide additional relief from chronic fatigue. These methods focus on treating the whole person rather than just the symptoms. Acupuncture involves inserting thin needles into specific points on the body to balance energy flow and reduce symptoms. Some studies suggest that acupuncture can help alleviate fatigue and improve overall energy levels. Massage therapy. Regular massage can reduce muscle tension, improve circulation, and promote relaxation, which may help alleviate fatigue. Consider options like Swedish massage or deep tissue massage based on your preferences and needs. Yoga and stretching. Yoga combines stretching, breathing, and relaxation techniques that can enhance physical and mental well-being. Choose gentle yoga routines that focus on relaxation and flexibility rather than intense physical exertion. Herbal supplements and essential oils. Herbs such as ginseng, rhodiola, and ashwagandha are known for their potential to boost energy and reduce fatigue. Hot oils like lavender and peppermint may provide calming effects and support overall energy levels when used in aromatherapy. Creating a personalized chronic fatigue management plan. Developing a personalized management plan is crucial for effectively dealing with chronic fatigue. This plan should be tailored to your unique needs and circumstances, considering your symptoms and lifestyle. Track your symptoms. Maintain a diary to record your daily symptoms, energy levels, and any triggers you notice, and this information will help you and your healthcare provider understand your condition better. Look for patterns or specific factors that worsen or improve your fatigue. Collaborate with healthcare providers, work with doctors, nutritionists, and therapists to create a comprehensive management plan. Establish realistic, achievable goals for managing symptoms and improving your quality of life. Implement and adjust. Start with a few manageable changes and gradually incorporate more strategies as you adjust. Regularly assess your progress and make adjustments to your plan based on what works best for you. Focus on self-care and patience. Make time for activities that promote relaxation and well-being, recovery and improvement. Take time, be patient with yourself, and acknowledge your progress, no matter how small. Managing chronic fatigue is no small feat, but with the right strategies, you can make significant strides toward relief and a better quality of life. From lifestyle changes to holistic therapies, there are many paths to explore. Remember, every journey is unique. What works for one person may not work for another, so it's essential to stay patient and open-minded. Take the first step today by incorporating some of these strategies into your routine, and don't hesitate to seek support from healthcare professionals along the way. Your path to relief and improved quality of life may be just around the corner.